That sounds good. Thank you, everyone, for joining us today. Um, let's do just a couple of introductions, a couple of people that will be helpful to know who we are. So I'm Katrina Miller. I'm the Infant and Early Childhood Mental Health Specialist with the Department of Early Learning and Care, DELC. And my role with DELC is to help think about how do we prevent suspension and expulsion? Broadly speaking, what are all the things that we should be considering to prevent suspension and expulsion? And within that, it's not the whole scope, but within that is building statewide access to infant and early childhood mental health consultation. So that we'll give a little bit of a program kind of overview of the kind of conceptually about the program, and then focus in more around the infant and early childhood mental health consultation. I am going to toss it to John, and then we'll go to Laura.
I like that. You tossed it. I think I caught it. I don't know if anybody saw it, but
Good
I'm
catch.
John Reeves. I'm the Professional Learning Systems Director at the Department of Early Learning and Care, and I am happy to see some familiar faces and some brand new faces. So really excited that you're all joining us today to hear a little bit about this request for proposal opportunity. And my department is focused on anything that relates to professional learning opportunities, coaching, any sorts of consultation work that we might do in communities. We also have the Inclusive Partners Program as a part of the work that we're mobilizing, and we're building the Early Childhood Suspension and Expulsion Prevention Program, which is what we're here to talk about today. So I will pass it on to Laura.
Hi, everyone. My name is Laura Spray. I am a senior contract specialist with DELC. I'm in the procurement department, and I will be the single point of contact on this procurement piece. So any questions pertaining to this RFP will go straight to me. And any questions you have about, organ buys or anything like that, I will be your point of contact. And my contact info will be available in the slides, also available on our website, in organ buys, etc.
Thank you, John and Laura. I'll spare the rest of my colleagues from introducing themselves for now, although who knows, we may call on you at some point later. So let me pull up my slides. They're not my slides, our slides for today. Is that showing up? All right, good. We had a little glitch earlier where the titles of the slides showed up in some either, I'm not sure what it was, something that was non-readable. So we think we problem solved that. So anyway, here is our agenda for this this hour together. We'll do kind of just a broad overview of the suspension and expulsion prevention program, how we're conceptualizing what the overview of the program is, the kind of large scope. We'll pause for some questions in there. Then we'll dive into more detail around specifically this RFP and what is the central entity and what is the scope of work that that we're seeking through this RFP. We'll highlight a few important dates, like the due date for proposals and Laura's contact information, and that will take us through the hour. So here is, we will repeat this again at the end, but Laura Spray is the single point of contact. Her email is here, and phone. These slides will be made available afterwards. They'll be posted. I think they'll be on our website. If they're not on our website, we'll find a way to link you to where they are. The due date, I don't think we have the due date on here. It's on the slide at the end. The due date for proposals is February 9th at 5 p.m. So a little background of how we got here. Back in, I think it was 2019 or 2020, I think it was 2020, the Governor's Racial Justice Council was convened. And there was it was partially in response to the events surrounding George Floyd's death, and really wanting to attend to how do we address racial equity in Oregon. And so the Governor's Racial Justice Council really took a deep look at that and identified a number of different things, but strategies and funding to prevent suspension and expulsion as a priority. So during the same time frame, and I think it maybe actually started earlier, was a steering committee that was composed of people from DELC, or what was the Early Learning Division, ELD at that time, and the Oregon Department of Education, as well as a variety of advocates, community partners, who really worked together, I think over the course of a few years, to develop kind of plans for what does preventing suspension and expulsion look like, and in that process, infant and early childhood mental health consultation was one of the things that was identified as a priority. So there also was community advocacy from Black Child Development PDX and Children's Institute and a variety of other organizations to really, again, like push the Oregon legislature to take seriously and to provide funding for preventing suspension and expulsion, to ban suspension and expulsion. So all of those things really led to the creation of the program. And then as the program was kind of just finding its first feet, DELC, ELD at the time, asked Portland State University to put together this report. It's titled Centering Racial Equity, Design Considerations for Oregon's Statewide Infant and Early Childhood Mental Health Consultation Program. And I wonder if, John, if you would be able to drop the link for that in the chat. Oh, I think you already did.
Done deal.
Done deal. Excellent. And we'll talk more about this a little bit later. But there is a wealth of information and ideas, recommendations in this report that we're using and embedding in the process of developing this program. So quick overview of the legislation. There are two pieces. Senate Bill 236 it goes into effect in July of 2026, but at that point there will be a ban on the use of suspension and expulsion in early learning and care programs. It will apply to programs that are certified or registered or that receive public funding. It also calls for a study on the use of suspension and expulsion and efforts to reduce and prevent the use of suspension and expulsion. And that study is in progress. Our partners at the Coalition of Communities of Color and AB Cultural Drivers are working on that research, and that will be due in September of 2024, which will be here before we know it, since here we are in 2024. So House Bill 2166 is the other legislation that was passed, and it officially established the Early Childhood Suspension and Expulsion Prevention Program. And within it, it calls for a wide array of services and supports and specific content and strategies related to promoting equity, promoting equity, promoting inclusion, and preventing suspension and expulsion. So we'll talk more about those details in the rest of the presentation. So the program purpose is, as you would expect, very similar to that. I'm going to actually start with the second bullet point. The second point says we want to reduce the use of suspension and expulsion at other forms of exclusionary practices. And we want to reduce the disparities in the use of suspension and expulsion. We know that children of color, and especially Black boys, and children with disabilities are the most likely to experience exclusionary discipline. But the flip side of that, if we are avoiding suspension and expulsion, the flip side of that is inclusion. So part of our program goals are to promote inclusive values, policies, practices that create opportunities for all young children and their families. So a little information here. This is kind of a high level view, and it could be its very own presentation, just this one slide. But there are a number of drivers that we know that when these conditions exist, expulsion is more likely to occur. So structural quality and organizational quality a lot of these are related to kind of larger system pieces about what ratios are, about staffing, about the availability of mental health consultation, about feelings of stress or hopelessness, not having sufficient staffing. So you're running from one thing to the next, or somebody's out today and it's a scramble to cover the classroom. We know that all of those things are challenges and make it harder to help support children. We also know that lack of knowledge and skills needed to promote social emotional development and address behavior problems. There is some indication that in terms of national research that a lot of educators have received minimal training or education around social emotional development. And even when they have learned about the stages of social emotional development, they haven't learned the next piece, which is how do you actually support children in developing social and emotional skills, moving from their current skill set to whatever comes next. We know there are a lot of racial disparities in discipline, things related to differences in perception about behavior. What may be a problem, viewed as a problem or viewed as a challenge for parents may be different than providers or educators. And we know that underprepared teachers are more likely to use punitive disciplinary practices. We also know there's a very real impact of implicit bias and explicit bias. There are also children who have experienced trauma or disruption, children who may be in foster care or have had some other type of disruption in their attachment relationships or the stability of their care. And that results sometimes in trauma-related behaviors. And so there is that, and then that shows up in group care settings. So there is, that's a very real thing that can show up in classrooms and drive suspension and expulsion. And then really big picture, we also know there are other systemic issues. These are just two of them: food insecurity, housing insecurity, and homelessness. It makes sense. If you're hungry, it's gonna be harder to, if you're a kid, if you're a child and you're hungry and you show up to your classroom, it's going to be harder to have tolerance for following the teacher's directions or doing whatever you need to do. Same thing if you're the educator. So this is a graphic that we use to kind of describe our overall approach to preventing suspension and expulsion. We think about, I'm going to start here in this kind of green quadrant. We think about what is the foundational training that early childhood educators need. We think about our training and technical assistance workforce. Both does this workforce, our technical assistance workforce, what additional support or training might they need, and how do they help support educators to prevent suspension and expulsion? How do we be very clear about that? I'm going to come over here now to the yellow quadrant. This is the infant and early childhood mental health consultation. And it is, this is something that is currently available in a few areas around the state, or has been available, and it has not been available in most areas of the state. But we're changing that. We are currently, I'll talk a little bit more later about our regional service providers, but we are in the process of oh my goodness, I'm losing my word. Establishing grants with organizations in the regions across Oregon who will hire mental health consultants and provide mental health consultation at the regional level. And then this RFP for the central entity is also closely related to that, although not exclusively related to that. And then this coordinated system of support is, how do we kind of tie all of these together and make sure that when an educator requests support to support a specific child or a specific situation, how do we ensure that that support is coordinated and not confusing? How do we make sure that we don't have two TA technical assistance professionals and a mental health consultant and a specialist from early childhood special education all showing up into the same space at the same time and potentially giving contradictory messages? We want to avoid that. So that's kind of part of this basis of the coordinated system of support. Another piece of this is what we call the warm line, which will be an access point for educators to request support when a child is at risk of suspension or expulsion, and hopefully early in the process before it's the last minute. So I think I pretty much talked through this. I'll have another slide here in just a minute that will show a few more details. And these slides will be available in the final slide deck. But this foundational training, how do we make sure that people, educators coming into the field, have what they need to support children? Our training and technical assistance workforce, supporting them and ensuring that we're utilizing their skills to the greatest possible extent to prevent suspension and expulsion. Infant and early childhood mental health consultation, coordinated system of support. Here's that warm line, and this sort of the process I referred to around this coordinated system, this kind of behind the scenes coordination. So here is another way of looking at it. And this actually aligns with this. It's a different shape, but it aligns with the same content here. Whoops, wrong direction. So universal promotion, this is, so the partners that we think of, and there may be more, that we think of as supporting universal promotion activities, CCR&Rs, higher education programs, the Oregon Registry. This is about the foundational training. This universal promotion. I'm going to pause for just a minute. I'm going to step back and say what this pyramid is. It's the public health model of prevention, which says we need to put our greatest effort investment at this universal promotion level. It needs to reach everybody. And so as we think about reaching everybody, we're thinking about who are those organizations and individuals whose role it is to provide that foundational training preparation that we know will help to ensure that children experience high quality early childhood education. The educators are prepared to support children. At the secondary prevention level, this is more or less equivalent to our technical assistance system. Our childcare resource and referral, inclusive partners. There probably are others that fit here too, but a technical assistance system that provides culturally responsive coaching, consultation to support educators, program leaders, to provide nurturing responsive relationships, high quality supportive environments, teaching strategies that support social emotional development. And then up here at the tertiary intervention level, this is where, so hopefully when we're doing a really good job at all of these layers, the universal promotion and secondary prevention layers, we are preventing the need for most tertiary intervention. But we're not going to get rid of it all. There's always going to be some need to support those particularly acute or individualized situations. And so we're really thinking about, there's really kind of two things here. One is early intervention, early childhood special education, which is provided when a child qualifies for an eligibility, a special education eligibility. And then infant and early childhood mental health consultation is another piece that we're building to help provide that support of what is, when there's situations are particularly acute, there's trauma, there's disruption, there's something going on, how do we access the skill set of those mental health consultants to help intervene here or help address the situation. And all of this, so the arrow here along the side is that coordinated and aligned system of support. Here's the same pyramid, but with, like, what are we talking about? So at the universal promotion level, we're talking about basic training in health and safety. We're also talking about basic training in racial equity and anti-bias practices, in helping educators understand how to promote positive racial identity development. It's making sure that educators understand child development, social emotional development, that they have those skills and abilities to teach children social emotional skills. Inclusive practices, trauma-informed or trauma-responsive practices, and workforce wellness. At the secondary level, we're again talking about these same content areas, but this is about kind of that technical assistance support to actually turn those concepts into actual practice in the classroom. Now, some of that also happens at the universal promotion level, but at the secondary prevention level, it's really that a little bit extra targeted or focused on helping with implementation of some of the challenges, some of the things that are challenging to implement. And here at the tertiary intervention level, again, we have mental health consultation, EI, ECSE, and to a great extent, not exclusively, but to a great extent, what consultants and special education providers are doing is they are using the same material as we have talked about here in the universal and secondary levels, but it is being applied on a more individualized basis or support for individualization. So DELC's goals, we're gonna talk now specifically about this infant and early childhood mental health consultation. What are our goals related to mental health consultation? It is, we want to develop a statewide model with enough flexibility for regional variation. The regions around the state are very different from each other. And so there needs to be enough flexibility in our model to not just accommodate it, but to celebrate it. But we have some really specific goals around preventing suspension and expulsion. We have specific goals, specific outcomes that we're seeking. And so in order to accomplish that, we're really looking to create a statewide model. We want to keep equity in the forefront of the design of the model. And this looks like a variety of different things. But it's not just about equity in outcomes for children, but it's about equity in for our workforce, equity in how we set up the structures for the program, how we ensure that consultants are prepared to address equity, to recognize and interrupt implicit bias when it's occurring. It looks like a whole variety of different things. But one of those pieces, one of the big pieces, is around diversifying the mental health consultation workforce. Nationally, we know that about 95% of the consultation workforce are white women, people who look like me. And if we want to truly center equity, and we do, we need to work on diversifying the workforce. And that's a multi-layered process. There's short-term strategies, there's long-term strategies. So in the short term, how do we think about I'm going to jump around here a little bit if you're following on the slide, but how do we think about supporting a grow your own model of somebody who may not have the traditional criteria, qualifications that mental health consultants might have? How do we expand that? How do we dig into that? How do we provide scholarships, and how do we collaborate with higher education to increase access? How do we also think about compensation? The mental health consultation skill set is a complex skill set. And how do we ensure that we're compensating our workforce well enough so that, for one, it's a livable wage, and two, that we're attracting the workforce that we want, and three, that we're keeping the workforce, that it's something that is sustainable. And also, how do we look at our compensation structures to value the lived experience of consultants who are people of color? So this is not all of the things. There's again, we could have another whole separate conversation that's just on these bullet points and more. Our goal, of course, also with this program is to effectively prevent suspension and expulsion and to reduce disparities in suspension and expulsion. Mental health consultation will not be the only thing that causes that results in those outcomes, but we want to make sure we're implementing, developing our program and implementing the services in a way that does prevent suspension and expulsion and reduces disparities. Our goals for this coordinated system of support is really the same. We want to prevent suspension and expulsion. And in order to do that, early educators, programs, they need a way to request support. It should be pretty simple. It should be pretty accessible. And then that response to the request should be coordinated, aligned, and collaborative so that we don't end up with multiple people going out to the same program or providing different messages. It's not to say that there aren't times when it is the right thing to have multiple people, but making sure that that's an intentional and thoughtful process instead of happenstance, or instead of the educator themselves having to be the one who is doing the coordination. Here's a graphic that kind of describes this process of the educator identifies a need for support, submits a request, that request is received, and there's this sort of behind the scenes teaming process. The educator is contacted, intentional and responsive support is provided. That support is individualized. It will be different depending on each situation. The goal is that the educator feels supported and that the efforts together help maintain that child's placement. It's not to say that occasionally there may be situations where a child will transition to a new program, But again, we want that to be a thoughtful and planful process, and not something where a family is told, sorry, please don't come back next week. So a comment about the role of the regional service providers, and then I think we'll have, I'll pause for questions about anything I've covered so far, and then we'll go into more details on the central entity. So the role of regional service providers, they are organizations located in each region of Oregon who will provide the mental health consultation services. So during phase one, which is where we're at right now with all of our organizations that we're in the contracting process with, we're going to be planning for implementation. So it is doing some planning around that coordinated system of support, making sure that whatever partnerships need to be in place are in place, and building understanding of mental health consultation and organizational readiness to implement mental health consultation. As we've been having conversations with these organizations and other people outside of these organizations, it's clear that we have work to do as a state in understanding what is mental health consultation, and that makes sense. Mental health consultation hasn't been available in very many places, and so it makes sense that we have a learning curve together as a state. And that's one of the areas that we are looking for support from the central entity with. So this is kind of in this planning for implementation. Different regional service providers will be at different places in the process. So some will transition to phase two, the implementation, in a relatively few months, where other organizations may take as much as a year to be ready to transition to implementation. So then at that phase two, at whatever point that transition happens, will be that recruitment and hiring of mental health consultants, responding to warm line requests for support in coordination and collaboration with other technical assistance partners in the region, and delivery of mental health consultation services to early educators and early learning programs. There is another piece in here that I didn't specifically call out on this slide, but is really an important piece of this phase one and preparation for recruitment and hiring. And that is related to workforce, of how do we think about who we are, what are the essential skill sets, how do we bring on a workforce that is ready and prepared to do this work, and or that we can help to develop that skill set through a grow your own process or some similar thing. All right, I'm gonna pause there and see if there are any questions at this point.
Katrina, am I asked to unmute or put it in the chat if I have any questions?
Good question. Go ahead and unmute and ask your question.
Thank you so much. Thank you for the presentation. It was very informational, and I wasn't sure, is this the time or is there another time? I had some questions on the RFP. I was just wondering, want to be appropriate with what you're doing today.
Yeah, thanks. So after this, I just wanted to pause here, kind of overall questions about the program or anything about regional service providers. Then I'm going to talk more specifically about the RFP and the central entity. So then hopefully that will answer some of your questions, and they will also have a pause for other questions along the way.
Thank you.
Katrina, there's a question in the chat, which is this a 1 year or a 2 year timeline?
Good question. So regional service providers are, Yeah, sorry, I'm stumbling around with that because I haven't quite thought about it in that way. This is a project that is starting now and we anticipate ongoing. The information, let me go back here, around regional service providers. This phase 1 of planning is happening anywhere between the next 4 to 12 months, and then transition to implementing, which our current pot of funding takes us to June of 2025, but we are expecting that that will be extended, and hoping that at some point we'll be able to even increase that. The RFP for the central entity will be the initial contract, will be for, or grant, I think it is, I'm not sure which it is. The original contract will be for approximately 18 months. It'll take us to June of 2025. And so at whatever point it's executed to June 2025, that number of months. And then again, we anticipate having the funding to carry that on, unless something changes. Yeah. Does that answer your question?
Yes, thank you so much.
You're welcome. Thank you for asking. Okay, let's go on, talk some more about the central entity and this RFP. And we have a place for some questions at the end. So this is kind of the summary, the 3 bullet point summary of the RFP. So DELC is seeking proposals from organizations who are, 1, ready and interested to provide leadership in equity-centered infant and early childhood mental health consultation, which includes those supports to the regional service providers. And the following slides after this one, I'll go into more detail about what's included in each of these. Number 2, we're looking for an organization who is interested in collaborating with us, with DELC, as well as early learning system partners, to develop that coordinated system of support. And we're looking for an organization who's committed to equity, to promoting equity in early learning programs, to promoting equity in the mental health consultation model, in helping us with workforce, both the mental health consultation workforce, but potentially how do we think about our workforce, broadly speaking, around making sure that we're prepared to address, to promote equity, address bias when it occurs. So let's go into the details. So the first part is this, I want to go back here for just a moment. This number 1, as I listed on this slide, we are conceptualizing that as a center of excellence on infant and early childhood mental health consultation. There is a center of excellence at Georgetown University. We're not trying to replicate them, but to be an Oregon center that is the organization that we can turn to for leadership, for knowledge around mental health consultation. So the first part of this is developing and implementing a statewide approach to equity-centered infant and early childhood mental health consultation. This includes a variety of things, more than what is listed on this slide, but among the things are standards and guidelines for program administration and delivery of mental health consultation in ways that are culturally responsive and center equity. There's a large workforce development component around supporting the skill development of mental health consultants. We know that there are going to be a lot of people who we are hiring to come into the field who this is going to be new for them, and there are things to be learned. So we're looking for core training, communities of practice, reflective supervision and where appropriate licensure supervision, equity dialogues, affinity spaces. There's probably more. I'm sure there's more. And then related to that is also developing a variety of strategies and workforce pathways to increase the diversity of the mental health consultation workforce. And again, that gets to that the short term and the long term ways of thinking about growing our workforce. So here is a picture of the Centering Racial Equity report that John shared in the chat a little while ago. Really encourage anybody who's interested in this RFP to take a deep dive into this report. It's a very thoughtful presentation of considerations for how do we think about equity, embedding equity, centering equity in the process of developing this mental health consultation program. So another aspect of the Center of Excellence work is providing technical assistance and implementation support to regional service providers. How do we distinguish mental health consultation from coaching or other technical assistance roles? Strategies to promote equitable hiring, compensation structures, providing support and guidance around developing authentic relationships, and also understanding the current context and the historical context of the communities being served. Engaging in quality improvement and evaluation activities. As a new program, we're going to be learning things left and right about what's working and what's not working, and what we need to think about differently or do differently. And so there's a component around just engaging in that continuous kind of assessment or reflection process as a program. So another aspect of the work is this coordinated system of support. We're hoping this central entity will help us with this development and implementation of a warm line, and determining we have a variety of outstanding questions around this warm line, and in terms of kind of the logistics and the operationalizing of it. And so it's how do we think together about that? There's a piece of coordination of mental health consultation with other technical assistance, just thinking through kind of at a system level and potentially problem solving situations around what does that coordination look like? How do we make sure that there aren't too many people showing up in the same space at the same time? Cross-system collaboration focused on ensuring our consultants and our TA professionals are prepared and supported to implement effective race equity interventions. And then the Early Childhood Suspension and Expulsion Prevention Program has an advisory committee, and we are looking for some support around the facilitation and just administrative aspects of convening the advisory committee. This is, I'm just going to, looking at the time, so I'm just going to briefly mention this. This is kind of a graphic that we are using to think about this coordinated system of support. When a request for support comes in, it will often come in with a specific child in mind. But that child and that child's family exist within the context of the early learning program that they're a part of. So then it's thinking about who are all the different potential organizations that provide support to that program and potentially are poised to help provide support related to whatever the situation is. So there is a piece here that is about understanding, working with, collaborating with all the different systems, all the different programs to understand kind of what's the niche of the mental health consultant, and how do we think about the collaboration and relationships with all of these other entities, with the goal of supporting the program to support the child and the family. We also know when that request for support is received. Again, it may come in related to a specific child, but it may or may not actually, the focus of the response may or may not actually be directly about the child. It could be that the educator is struggling, something maybe they experienced a difficult or traumatic event in their life or their community, and the educator's mental health is they're struggling, or this is an educator who doesn't have a deep knowledge of child development, and so the expectations for this child are not in line with what the child's actually developmentally capable of, or staffing. So it could be any number of things. This is not meant to be an exhaustive depiction of all the issues. It's just a sampling. But that's where I think there's a big area across our system to think together about what are all of those factors that drive suspension and expulsion, and how do we think about it in a way that does not pathologize the child, does not put the blame on the child, even if it's the child who's demonstrating behaviors. The children will demonstrate behaviors in relationship to things that adults do. So we want to find ways to provide support to the child, provide support to the educator, the program, to help maintain the child's placement and the well-being of the educator. So then, promoting equity in early learning. This is another piece of what we're looking for from this central entity. So it's the responsibility of all of us, all systems, all organizations, all of us as individuals, to really think about and work towards equity. So it is not, we can't expect that the central entity will be the one and only organization that will help DELC to implement equity in early learning programs. But it is essential that this organization have a role in collaborating with, in providing leadership and collaborating with equity leaders across the state and early learning system leaders to really look at how do we promote racial equity in early learning programs. So there are a few specific things that are called out in the legislation, such as common definitions, shared standards, and beyond what's specifically called out in the legislation, we just want an organization that will think together with us and with like all the partners, all the programs, about how do we really work intensively and intentionally to promote equity in early learning programs. Important dates. And then just after this, I will pause for any questions. So the RFP is available now. We are here today at the pre-proposal webinar. And then January 31st, Wednesday, January 31st, this is between now and then, you have an opportunity to submit questions for clarification. And those questions, requests for clarification, should be sent to Laura Spray, and then answers will be posted. Laura, correct me if I am wrong, but they will be posted in Oregon Buys. Is that correct?
Correct.
Okay.
It can also be, I mean, any questions can be submitted in Oregon Buys as well as emailed to me.
Okay. Thanks. That's helpful. Then it officially, the RFP officially closes Friday, February 9th at 5 p.m. Note the 5 o'clock p.m., not 5:05, not 5:30. I'm afraid there's a hard deadline with 5 o'clock, and there's, with the rules that exist around procurement law, there's no flexibility. So following that, there will be an evaluation process, and then we are expecting to schedule a second round related of interviews. So evaluations that that all proposals will be evaluated. Proposals that meet a certain threshold will move on to an interview. And then by February 26th, approximately, hopefully, we will be issuing a notice of intent to award. And then there will be a protest period, following which we will move to a contract. Again, this slide is Laura's contact information and the link to Oregon Buys. I wonder if, Laura, you could drop the link to Oregon Buys in the chat.
Sure.
And then we're at questions. It looks like we just have a few minutes left, but any questions?
Katrina, this is Patty. I'm Patricia Kavanaugh with Help Me Grow. Nice to meet you. I think we've met before. I did have a couple questions and I wasn't sure if I'd have enough time. I didn't want to take up everyone's time. But in the document that was the link for the RFP in section 3.29 on page 24, can you provide guidance on when a proposer intends to use subcontractors not yet identified? The requirement of providing the 4 reference letters from current or past clients and organizations. Just kind of wanting more guidance on that.
Yeah, so the sorry, the question, I'm thinking about it in the document in my brain. The question about the reference letters, we're simply looking for the reference forms from other organizations that your organization has had a business relationship with, or consulting, some type of relationship where they can report on how it was, in a sense, to work with you. Does that?
Yes, if I was asking specifically if a proposer intends to use subcontractors not yet identified. I'm sorry if I didn't.
Oh, gotcha. Okay.
Yeah.
Yes. So there's a significant scope of work here, right, with this RFP. And so there could be a situation where your organization is feels very like ready and prepared to do a particular component, and also has in mind that there may be a subcontracting, a piece that you would like to subcontract to a different organization. That is the timeline between now and when proposals are due may mean that it's not possible to completely establish who the subcontractors might be. But thinking about what would be the characteristic, like what portion of work would you want to subcontract out? How would you go about identifying who that would be? Those kind of things. Does that help?
Yeah, I'm sorry. I'm just, I was in my car because I was going to go to my appointment at 3, but I was going to wait a little bit and hear if there was an opportunity to ask. I guess I'm just kind of wondering, looking at a particular circumstances, if you are not yet identified subcontractors and the key people you would need to implement this type of work, here being the Center of Excellence, the requirement of the 4 reference letters, maybe a challenge for some organizations, especially if you're intending to subcontract out. I'm just wondering about that. And I could just formulate more questions and ask Laura, more specifically when I kind of process this a little bit, but that's what I was intending to do. But thank you.
Yeah, I think that would be helpful if you could just, whatever questions you have, particularly pertaining to a specific RFP section, go ahead and email that to me. That way I can make sure I have a very clear understanding of what you're asking and get you a good answer, hopefully.
Thank you so much. Thank you.
Thank you.
Just a couple minutes left. Anything else? All right. Well, thank you so much for coming today. Again, do please submit questions either via Oregon Buys or by emailing Laura. And then those responses again will be posted in Oregon Buys. This webinar will be, it has been recorded. It will probably take us a few days, but it will be posted probably on our website. We'll figure out where it's going to be posted and make sure that that information is made available, as well as the slides. Thank you all.
Thank you. Thank you, everyone.